Hi, Brian.
How are you? That's why I was like, he's going to be there. Thank you.
Commissioner Erickson Gall. Here. Commissioner Taylor.
Here.
Commissioner Spez.
Present.
Commissioner Howell.
Here.
Commissioner Gingell. Absent notice. And Commissioner Lutz.
Here,
We have quorum.
thank you. Please rise and join me in the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America,
and
to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Our first item is approving the minutes from April 1st, 2025. I have a motion by Commissioner Taylor and support from Commissioner Spiz. All in favor say aye.
Aye.
Opposed? Our minutes are approved. Next, we approve the agenda. I have a motion from Commissioner Taylor and support from Commissioner Erickson Gall. All in favor say aye.
Aye.
Opposed? Our agenda is approved. We've arrived at our first public comment. This is for public comment on items on the agenda. Is there anyone from the public wishing to comment at this time? Seeing none, public comment is closed. And we will now move to our presentation, which is from OCHN regarding our ARPA report update. And I thank you, you know the routine. Welcome.
Thank you very much for having us. Well, I'm Frances Carley, the Director of Strategic Initiatives, Oakland Community Health Network, and thank you for having us today for this presentation.
My name is Siri Sikora. I'm the Director of Justice Initiatives at OCHN.
And I'm Tradina Taylor, Director of Access at OCHN.
Okay, so to get started today, we really appreciate the opportunity to share updates on the quarterly funding. So we have our second quarterly funding report summary, and I believe that's part of the board packet today. And so we're here basically to share updates on these programs and just to give a little orientation about OCHN. As a reminder, OCHN is both the Community Mental Health Special Services Program Authority in Oakland County, as well as the Prepaid Inpatient Health Plan, so the CMHSP and the PIP. On the CMHSP side, that means that we're part of the behavioral health authority and system that has been operating in Michigan and Oakland County for more than 60 years, providing direct services for our core Medicaid population, the population that has the most severe and serious mental health, behavioral health needs, but then also the income level needs. So we provide the mental health and substance use services and the intellectual developmental disability services for the county and serve as the safety net. With the PIHP side, that's where we are being local authority for the state Medicaid. So there are 10 PIHPs in the state. We are one of 10, and so the PIHP system is where you get that. The Medicaid dollar is with being local control, and so that is how OCHN is able to reinvest and partner with the county commissioners, our public health department, the sheriff's office, and other very close partners on some of these initiatives. And so we have our some of our key initiatives and what we've partnered with the county on through the ARPA funding. That all ties into our strategic focus areas. We're currently in the process of going through our next strategic planning process for 26 through 28. We're in our final year of the current 3-year strategic plan. We're focusing on the staffing and retention. Everyone knows the behavioral health workforce issues. It's an issue nationwide that's affecting the entire system. Quality system of care, administration and service delivery for the managed care system, integrated healthcare, and that also ties in with our walk-in center, which is a partnership with the public health department and Honor Community Health at FQHC in Pontiac, and also our partnerships, advocacy, and outreach. And so that's a very key component of the programs that we're going to be discussing today. So as part of the grant, the quarterly update and part of the ARPA plan, OCHN and the county commissioners, we've been working on several programs, and this is part of many of these programs. We have some other funding sources, say for the co-responder, but then some of the other programs are exclusively connected with the grant awards from the county. And so today we're going to be discussing the co-responder program, the crisis intervention team program, mental health school navigators, and as part of the school navigators, we also have an all-county kind of co-pay insurance deductible opportunity for students and families to obtain mental health services and to have that additional financial assistance and support, and that is throughout the entire county. And then we also have of course, the Oxford copay and deductible fund, and so we'll also be discussing that today. That I will turn it over to Siri Sikora to talk about the justice programs.
Thank you. So I will be providing you a brief update about our co-responder initiative. That initiative has actually been in place since August of 2021. The overall goal behind the co-responder initiative is to embed master level clinicians, so your social workers, counselors, psychologists, with Oklahoma County law enforcement agencies. Our co-responders respond to mental health and crisis-related calls when an individual called 911, but dispatch were able to identify a potential behavioral health concern. So co-responders respond with law enforcement together to de-escalate, provide crisis intervention, and then ideally connect the individual to resources in the community. We want to divert into treatment whenever possible and avoid incarceration or unnecessary emergency room trips and hospitalizations. So at this moment, we are a team of 9 co-responders with 1 supervisor and 1 admin assistant. Under the ARPA funds, we have the supervisor, the admin assistant, and currently two co-responders funded. We still have room for 3 more co-responders, and we're currently in the works of finishing up some of those contracts. So the 2 co-responders that are funded under ARPA are embedded in 4 departments, and they're very busy. So you do have a small statistic on your slide that shows that in 6 months alone, those 4 departments provided over 800 referrals to our co-responders. So those communities are definitely busy. At this very moment, we're finishing up a contract with 5 more police departments for 1 co-responder, and that gives us another year and a half until the ARPA funds expire to embed the other 2 co-responders in some more police departments. So as of recently, we had attended an Oakland County City Manager meeting as well as a Chief of Police meeting to continue to advocate on this effort and also gauge interest on who would be interested in having clinicians embedded within their department. Since 2001, we have accepted over 6,700 referrals from a total of 16 communities. So our 9 co-responders are embedded at this point at 16 communities. Our statistics that you see on the slide are pretty consistent across all departments. We're happy to say that on average 49% of the individuals remain in the community, only with a 3% arrest rate, and then 21% of being transported to the hospital for further evaluation. As it relates to our crisis intervention team effort that has been in place actually since 2015, the goal is to provide a 40-hour training to law enforcement agencies or law enforcement officers on how to interact with someone in a crisis situation when they call 911. Not everybody has a social worker or a counselor, of course, embedded in their department, so it's good for law enforcement officers to also have those skills and properly de-escalate in a crisis situation. The ARPA funds have really given us the opportunity to get the buy-in from the law enforcement agencies. In order for an officer to attend a 40-hour training, they have to pull that officer off the road. So the ARPA funds have allowed us to provide the law enforcement agencies with reimbursement so that they could backfill the position for that whole week. We have also hired a CIT coordinator that has really coordinated all the trainings over the last year and a half, 2 years. And we've held a total of 13 trainings. 2 of those were youth and 11 were adults, which has allowed us to train 261 officers under the ARPA funds. Some of the funding has also gone towards training materials, providing food and beverages during the 40-hour training, CIT certifications, CIT train the trainer events, and program certifications. So really using that funding towards the sustainability of this effort in Oakland County. And with that, I hand it off to Tridina.
All right. So I'm going to talk about the mental health school navigators. Under my purview, I have lots of small teams within my mighty large team at Access. So that's the veteran navigators, the school navigators. Francis mentioned the walk-in center. We have someone embedded in the Southfield Health Division. We had a jail person, but some funding changed and we had to pull that person back. But I have to say to mental health school navigators, I'm pretty proud. I'm not biased. I don't want any of my team members thinking I'm biased. I'm not biased. However, the mental health school navigators is an amazing program. The goal was to increase access to behavioral health services and supports for Oakland County students and families. And it came about in August 2021 at a time, we went through a pandemic and we all know how that impacted our children. They had to, they were graduating from home, they were getting ready to go to college, like all the things, homeschool, things that we just had to pivot and learn how to deal with. So how about how that have impacted the children, right? And then unfortunately, we had other events, school shootings and things like that around the same time. So my goodness, this just came at a really good time because these students really needed that extra support, right? So with the ARPA funds, it supports 4 navigators and 1 school mental health referral specialist. We have been pretty fiscally responsible because we have been working with 3 navigators and 1 school mental health referral specialist. And we have been, I look at the data and I think we've been doing good with managing without having that 4th as of yet. Because I want you to know that even though that was a lot of tests, we are being fiscally responsible with that. So also, since they launched in 2021, there were 398 of the 458 Oakland County schools that they touched. And why haven't we touched all? We have reached out to schools. Some schools aren't engaging. Some schools rather not. Some schools rather deal with it on their own. And of course, we don't want to be pushy. We just let them know we're here, we're out here. And they continue to every semester or once a year, they'll reach out to those schools because maybe something will change. And maybe they'll reach out and say, okay, we'll work with you. But we have reached out. That is the pre's, the private, the charters, the public schools. So it's not just the public school system that we're reaching out to. We've had 213 referrals in FY23, and look at there, FY24, we've increased to 591 referrals. So, and that's what I'm seeing with the data. Everything is constantly increasing with them. But one thing that I must say, there is a gap with this. It actually identified another really big gap with the mental health school navigators, the intellectual and developmental disability population. And I say a gap that I don't think no one really paid attention to. Me, myself, I am a mom of a daughter with autism. And I remember when she turned 18, there were all these, do I apply for guardianship? What's this MORC? What's this CLS? Oh my goodness, Social Security, Medicaid, what do I do? And I worked in the system, and it was very overwhelming to decide, oh, does she graduate from school, or do I get a certificate of completion? What does that mean? What does that look like for her? How do I have and help her have a meaningful life, just like any other 18-year-old? So it was overwhelming to me as someone who knows the system. So imagine these parents who don't know the system, and they're trying to figure out all those things, and how do I navigate that? Well, that was one thing we saw the mental health school navigators really found that gap and that missing piece, and they really worked really closely with the school transition coordinators, with those 18 to 21. They're trying to decide what to do with the child, because they're not going to Wayne State and Oakland University, but they need to have a meaningful life as well. So that was a really big gap that I don't think any of us thought that was going to be something that they assisted with, that they have really done a really good, beautiful job with, and it shows in the numbers of the IDD, intellectual developmental disability individuals that they support. So another part of this wonderful program is that there are parents that don't have Medicaid and they have Blue Cross, and I need to assist my children and my daughter, son, my family. They need behavioral health or mental health services. But man, I gotta pay $100 every time I see a therapist, $150 co-insurance every time I see a psychiatrist, and I gotta pay for the prescriptions. So this is a wonderful thing as well. We have the co-pay benefits. So families, we have one for Oxford, and that one specifically works with individuals that was impacted by the Oxford shooting a few years ago. Then we have separately the All County. So that's anyone in Oakland County, any student in Oakland County who they're not maybe receiving services with OCHN or one of our provider networks, but they have Blue Cross, and they're struggling with continuing behavioral health services for their child because of the co-payment, co-insurance, the deductible, and I just need a little help. So they submit that to us via receipt and submit the necessary documents, and we reimburse them for that. So they can continue to get the same services without any delays or barriers with their child receiving services. So I think that's the really wonderful thing that this ARPA funding has assisted with. And we've had 191 Oxford individuals that's been served and 325 all-county persons that has been served with this funding. So amazing. Next steps. Passing it back to Frances.
And then, thank you. In terms of next steps, as much as we can, we intend to continue these programs and providing these services. And I think this has been reflective of these very strong partnerships. And we are constantly looking at the sustainability planning, what to do, with some of the uncertainties at the federal and state level. And within that, there is a very strong level of commitment and support for these programs. And I think it's across not just at OCHN, but it's in the broader community. And so we do want to continue having these conversations about sustainability and what we can do together to keep these programs operating.
I know 3 of the 4 programs were started here at the board and contracted with OCHN, who we do consider a great partner. And I want you to know that 2 of these ladies I have worked with in the past before, and they're amazing.
Well, thank you.
Yeah,
So the
thank you.
money that's remaining in these funds, are you going to be able to spend them by the end of the fiscal year?
Well, it does vary. So by the end of the current fiscal year, the Mental Health School Navigator, that program, that funding will run out sooner than later. And as far as the co-responder, I'll let Siri address that. But I believe that from what I understand, the ARPA funding does go through
December 26th.
through 26. So I believe we do have a bit of time on that.
Okay.
And that is the plan. Out of the 7 positions funded for the co-responder initiative, we have 4 currently filled, with 1 that we expect to be filled over the summer. And that really gives us that year and a half to fill the last 2 positions. And that's what we're seeing with the co-responder initiative. The planning phase with the communities and drafting into locals policies, going to the cities and township councils takes time. So we had to stagger the effort a little bit. So yes, we do anticipate to fill those last 2 positions by next year. The crisis intervention team training interlocal has ended as of December of last year.
Okay, thank you. Other questions or comments? All right, keep up the good work.
Thank you for having us.
Thank you.
Then I'll entertain a motion to accept the
So moved.
presentation. Moved by Commissioner Spitz, supported by Commissioner Powell. All in favor, say aye.
Aye.
Opposed? All right, thank you. The information is received. Our next item is communications. There are also ARPA reports, one from our out-of-school time final report, which included 29 programs over the last 2-year period, an ARPA Senior Chore Program report, and the Haven Quarter 2 report. We have 1 grant acceptance from Michigan Association for Public Health for the fiscal year 2025 Local Health Department Wellbeing Program, and 2 grant amendments. The first from the Michigan Department of Health and Human Services for the 2025 Crime Victim Rights Program, and the second amendment is to the Alliance for Housing Subrecipient Agreement for the Community Development Block Grant and Emergency Solutions Grant. Is there someone that would like to make a motion? I have a motion by Commissioner Taylor, and I have support from Commissioner Powell. Are there any questions regarding these reports? Do you like a prompt or a voice? Okay. All right, would you prompt the vote?
Five yeas, 0 nays.
Thank you. Then our communications are approved. We move to Health and Human Services. There are 3 items. One is a grant acceptance from the Michigan Department of Licensing and Regulatory Affairs for the 2025 Medical Marijuana Operation and Oversight Grant. The next 2 are grant exception requests. The first, an application to the Michigan Health Endowment for the 2025 Nutrition and Healthy Lifestyles Grant Program. The second exception request is an application to the City of Pontiac for the Opiate Prevention and Intervention Resources Program. I found that one interesting because our health department is applying to the city of Pontiac for a grant. So, who do we, we have Kate Guzman and Leanne Stafford here. Do I have a,
Good morning. As usual, Leanne and I will share this. We go back and forth.
okay, hold
I'm
on,
here this morning to
one
start
second,
off
Kate.
with-
One
sorry.
moment, I need a motion for this. I have a motion by Commissioner Taylor and support from Commissioner Erickson Galt. So thank you, sorry to interrupt you.
I'm sorry. Are you ready now?
I'm ready now.
We're starting with the medical marijuana operation and oversight grant acceptance, which is in the amount of $432,000 or $432,036. So I'm sure you're all aware of this grant. We've had it for 4 to 5 years now. And over the past few years, we've really learned that the success of this program is around lockboxes and lock bags that we distribute at outreaches in partnership with many community agencies. And so we will be purchasing approximately 5,000 lockboxes and lock bags with this funding, and have a robust advertising campaign where we'll work with good marketing to target our topic areas of impaired driving, pregnancy and breastfeeding, youth use, and safe storage.
Are these items you pass out to our local police departments?
Yeah, we've got the, I have a list here, healthcare professionals, substance use and behavioral health providers, elected officials, community health organizations, juvenile justice system professionals, and public health professionals. It doesn't specifically say the sheriff's department. Maybe Leanne would know. I don't have much experience with this grant, I'll be honest.
Thank you.
If we receive requests from local law enforcement for some additional lock boxes or lock bags, we would give them to them. Just like to commissioners as well, we've received requests from you all to give them out at some of your own events. Happy to provide those to anyone that's interested in giving them out.
Thank you.
Thank you.
You want us to keep going and then
Yeah.
other questions could be at the end?
Sure.
Okay, so the next request we have in front of you is a request to apply for a grant. If you remember, you all, the Board of Commissioners actually allocated money for a food landscape study. And so we are finishing that food landscape study and we'll be presenting the final report to you all. Our plan is either late May or early June, we'll bring the report to this board. But a few outcomes that came out of the study is one, to really provide technical assistance for our smaller pantries and also really focus on capacity building for them. And so we have an opportunity to apply for this grant that will allow us to do some of that TA capacity building for not only pantries, but also our food policy council. And so we didn't want to miss that opportunity to apply for this. And actually, we're invited to apply for this grant, which is a really good opportunity for us. We will staff one PT&E position with this money, and we're looking at just under $330,000 for the grant over 2 years.
Thank you.
So the third one you have in front of you is our opioid prevention Pontiac RFP. So our team has put together a proposal in the amount of $145,756 to the city of Pontiac to focus on 4 key components. So we've got a one piece that is school prevention programming in Pontiac elementary and middle schools. The next arm is a media campaign to prevent opioid misuse. And then we have an aspect that focuses on the harm reduction and care coordination within the jail. And the last piece are some community educational sessions.
Thank you.
So those are our items.
Comments or questions regarding these 3 items? Commissioner Powell?
Who's oversighting that last grant? Would it be us or the city of Pontiac, or is it a partnership between the two with all the activities that y'all planning to do?
So this would be a health division project, receiving funding from the city of Pontiac, but this proposal would be run, like this piece of their funding would come to us to run these projects.
So is this a thing that's supposed to just benefit City of Pontiac residents, or is it gonna be something that y'all got from them to still help Oakland County?
We will be focusing the education efforts in the schools in the city of Pontiac, but all of our other initiatives would include the entire county.
But it's funding from the City of Pontiac, so wouldn't it govern just the City of Pontiac?
I think she's saying that item 9C is for the city of Pontiac. There are other items that we have
Attached to it.
approved under the opiate settlement funds that address other areas in Oakland County.
But not using this grant money,
Correct.
is that correct?
Yeah, so when we think about like a media campaign, we would focus our billboards, our advertising would be focused at the city of Pontiac. The care coordination in the jail is a little trickier to really pinpoint city of Pontiac. That may be one that is a little broader than what you're really asking about city of Pontiac, but we are looking to do care coordination in the jail.
Yeah, I'm just interested in how all that money gonna be spent because it's a grant coming from, you all are applying for it to come from Pontiac, so I will hope that this 145 is to benefit that city since y'all got the money from that city. And then any other opioid money that we do have that governs, so I just wanted to hear that clarity, and I'll be interested to see this budget eventually once it's done. Thank you.
Thank you.
Any other questions? All right, would you prompt the vote, please?
You know why I'm asking. What's going on?
You have 5 yeas, 0 nays.
All right, motion carries. Thank you for joining us.
Thank you.
Thank you.
Our next item is a public service recommendation. It is a transfer of funds from the Pet Adoption Legacy Fund. I have a motion by Commissioner Spiz. And I have support from Commissioner Erickson Galt, and we have Bob Cat here to talk to us.
Good morning, Commissioners.
Good morning.
It's always a pleasure to come here and speak to you. I think I have a simple request for you this morning, but before I get into it, I just want to tell you about last month. We sent a communication over to you. We report our numbers every month. But in March of 25, in my 12, almost 13 years with the shelter now, our live release rate, now you can measure what we do at the shelter in a myriad of different ways, but to me, the most important way to measure what we're doing is how many animals leave the shelter alive, you know. And last month, we had a live release rate of dogs of 96.3% and cats 93.2%. Now, those of you who know, have been around, you know that we used to have people with banners and placards saying, you know, no kill, no kill, no kill. No kill is the number that somebody made up, 20 years ago that said if you have a live release rate of 90% or more, you can call your shelter a no-kill shelter. Now, I can't guarantee these numbers every month because our shelter, as you know, is an open admission shelter where some shelters are private and they can turn away certain breeds or they don't want a big dog this month or whatever. They can make up their own rules. We can't. We take every animal that comes in from our area of service. And so 1 month we might get something that we can't control that would drive these numbers down. But these are amazing numbers and, I'd like to take credit, but it's not me. It's the people who work there and I've said before and I'll say it again, they love their jobs and they love their animals and it's just a great place to work really. So I just want to acknowledge that. So today I'm here, I'm asking permission to spend up to $39,000 from our legacy fund. Now, our legacy fund is the fund set up by the board long before I arrived on the scene. And it's where all the donated monies go into. And people they astound me with their generosity year after year after year. They donate monies for the betterment of the dogs and cats in our facility. Now, we haven't spent any money out of that fund in many years, other than we improved our outdoor kennel area in the last couple of years. We now have 19 new outdoor kennels that we'll use 10 months out of the year, which will make the dogs happier and more easily adoptable. Our legacy fund is very healthy. Last I looked a couple of weeks ago, it had $1.2 million in it. So the $39,000, up to $39,000, we want to spend in 3 different ways. I'm going to go, not in any matters of importance. I have Lieutenant Burwell here with me, because one of the things we're going to do is further our partnership with the Oakland County Sheriff's Office. You probably know this, but in case you don't, all of our animal control officers have special deputy status with the Sheriff's Office. So do I, so does our chief, so do our 2 supervisors in the building. That has come in handy more often than I can count. Just not long ago, we had somebody in the lobby that we wanted to release a dog to him, but he would not buy a license. He said it was unconstitutional to charge him for a license. So in any way, to alleviate the problem, I was there and I was able to write him a ticket. Then we let the courts adjudicate that. Our officers on the road, without that deputy status, they wouldn't be able to write tickets or seek warrants, so on and so forth, and they do such a marvelous job. The opportunity has come up through the office, through Lieutenant Burwell here, to give a couple of our officers the opportunity to become part of their search and rescue team. Now, you may have seen things in the news on Channel 2, Channel 4, Channel 7, the Detroit News. Not long ago, we had a swan that was trapped in the ice in one of our local lakes. And we don't normally deal with wildlife. That's a DNR problem, if you will. But their solution, the DNR, was to shoot it. And of course, there was hundreds of residents around the shoreline, and we're not going to shoot a swan. And we're just not going to do that. We don't like to shoot. We don't like to euthanize any animal unless we have to. That's why our live release rate is so high. But this team went out. We were not a member of their team at the time, but the team went out, rescued the swan, brought it back to our officer waiting on the shore, and it made marvelous Channel 4, 7, and 2 PR. If we could train with the Sheriff's Office and respond to animal-related calls, it will make our department better. It'll make our department more professional. And it will make us, I believe, in a stratosphere where there's no other animal control agencies in. And we're already up there, but I want to continue to make us better. I have 2 officers that volunteered to be part of the team. And if we get permission to move forward today, Lieutenant Burwell has given us a list of equipment that we need, uniforms for the officers. I'm going to work with Gaia and we'll get that equipment ordered and charged to our Legacy Fund account. Another thing we want to do is we want to establish a second feral cat colony on our grounds. Now, again, those of us who've been around a long time know that there was a time when the Oakland County Animal Shelter euthanized feral cats. If you brought us a feral cat and we deemed it to be unadoptable, that cat would be euthanized. And it was the policy of the county. And behind closed doors, I talked to people above my pay grade and tried to change their mind. But it was a no-go. And so this year, or not this year, but last year, we went to the powers that be and we asked permission to start a feral cat colony using 4 feral cats that we had in our building that really had nowhere to be returned. You know that we do the TNR, trap, neuter, and return now. If you bring us a feral cat, we neuter, spay it, we bring it back to where it was found, and we let it go. We had 4 cats in our building that had nowhere to go. The colony caregiver had passed away, and there was nothing to do with these cats. But I refused to have them euthanized, so we kept them in the building, we kept them in cages. So we went to the health department, we went to the administration, and they gave us permission to start a feral cat colony outside in the corner of our parking lot. And it was amazing. 4 cats went out there. We put up some cameras so we could watch them. Within a couple weeks, there was a 5th cat, some cat that was hanging around out in the woods behind us, and he or she joined the colony, if you will. We put food out for them. We made sure that the structure that they were in, that they had access to, was safe. We ran some electric lines out, and we put some heated blankets out for them in the winter. After a couple months, one of the 5 cats decided he wanted to come back in. He didn't like the outside so much. So we brought him back in, and he's been adopted, as a matter of fact. The one cat that came and joined our colony has since left. He said he was only there for a short time, and he took off. We now have, so there's 3 cats original, and they're still out. They're still healthy and happy and alive. We have 4 more cats we can't put in with this colony because just like in the real world, sometimes they don't get along with each other. So we're asking permission to start another cat colony. We need some money to buy some equipment. So that's one thing we would do with the money. And the third thing we want to do is to buy some incubators. And the reason for those are just like humans. Some of our baby kittens, some of our baby puppies, they need incubators with oxygen to survive. And heretofore, we don't have that. And oftentimes, the kittens or the puppies will not survive. If we had a few incubators in the house, it would help us save the lives of these baby animals. So if we could have permission to spend up to $39,000, we would join the Oakland County Sheriff's Office Search and Rescue Team. We would establish a second cat colony on our property. You know, we didn't make a big deal of it last year because we didn't want to publicize it. There was some concern on some of the administrative parts of, oh my goodness, the cats might be dangerous, or they might hurt the children from the Little Oaks, a quarter mile away. They might do a lot of things. None of that happened. So we didn't want to publicize it too much because we didn't want people to think, oh, they'll just come and dump their cat off there and join the colony. It's not the way it works. But we're ready for our second cat colony now, and we have 4 cats in the building that we would start it with. And then the incubators speak for themselves. So with that, Lieutenant, did I miss anything?
I don't think you.
Thank you. Now,
I talk a lot, I know. It's easy to talk about the
you
animal.
probably don't have many questions because it sounds marvelous. But you said you trap, neuter, and spay the feral cats and release them back when possible. What's the cost to neuter and spay a cat at?
We do that at no cost to the owners. If they bring us feral cats, we will spay or neuter them and return them to where they came from. Now, we make them sign a piece of paper because sometimes people may be dishonest, or maybe they're just not cognizant of the fact that their cat is really not feral. And so when we get cats in that are tame, that are adoptable, the piece of paper that people sign say that we keep those cats and adopt them out.
Thank you. So do you actually trap those?
We do not do the trapping, no. We do have traps in the building. If somebody needed to borrow them, we would certainly supply them with a couple. But mostly these are professional trappers that are hired by either subdivisions or mobile home parks.
Yeah, a few years ago, my neighbors and I trapped feral cats to have them spayed and neutered,
Yes,
where they cut their ear and.
they
and then
chip their ear.
Yes,
And that's a sign to anybody that's in business that that cat has been neutered.
and you can absolutely tell the difference in behavior
100%.
between a feral
Yeah.
cat and a
Well,
house
a
cat.
feral cat, Commissioner, they don't want to be touched. You say, people who are afraid of them, they don't understand that the feral cat, they don't want any part of a human being. They want to be away from you. Now, if you corner one, that cat is going to use all of its cat instincts to become free. But if it has a chance to disappear, there's nobody on campus that has called us and said, hey, your feral cats are running wild in my backyard here, you know. So we're pretty certain that they don't want to be seen and they're very good at hiding.
Right, thank you.
Thank you.
Commissioner Powell?
Feral cat, can you spell that?
Feral? F-E-R-A-L.
Feral, okay.
Feral.
I ain't never heard of this.
Never.
I'm pretty surprised at the different type of cats, all this is like blowing my mind. I didn't know it was even a difference in
Wild
cats from, wild cats and
You should go spend a
house
couple
cats.
days at the animal shelter.
But see, I'm not an animal lover. I'm very, so that's why I
Might be
don't,
after
but
you
I
spend a
just
couple
didn't know,
days.
so I wanted to know how you spell it, so I go look and research this stuff.
Well, they're
Okay.
all over the world, there are problems with feral cats.
Okay.
Because left unchecked, a female mom can have up to 7 or 8 litters a year, and each litter is, 7 to 10 cats. And you do the math, I mean, within a few years, there can be millions of cats running around, and indeed there are, so.
I'm happy to have them in my neighborhood because they take care of the billion rats.
Well, they do. Now, people who are anti-feral cats say they also kill birds and other wildlife that, they're hunters. Cats are the best hunters known to mankind. They can sneak across, and they're very good at what they do. But they serve a purpose too, you're right.
Thank you. Any other questions?
No, he answered all my questions.
All right, would you prompt the vote, please?
I ain't fooling you, no, man. They cost too much.
5 yeas, 0 nays.
I didn't know they.
Motion carries. Thank you very much.
Thank you.
Our next 3 items are Sheriff's Office recommendations. The first is establishing the Marine Patrol Services Agreement rate for May 1, 2025 through December 31st, 2027. The second is the use of non-departmental general fund contingency for the 2025 Woodward Dream Cruise Special Event signage by the Road Commission for Oakland County. And the last item is regarding the use of forfeited funds. I have a motion by Commissioner Spitz. I have support from Commissioner Taylor.
And I'd also like to make a request. I'd like to separate item A from B and C, please.
Thank you. I would be happy to separate items A, B, and C. All right, what would you like us to know about the patrol service agreement?
Good morning. So Gail Pierce, Sheriff Fiscal Officer, and Under Sheriff Tim Willis.
Hello.
So the first item are the Marine Patrol rates for May 1st of 25 through December 31st, 2027. As you know, voting season is right around the corner. So what we do is contract with communities that have lake associations that want additional patrols. Obviously, Marine does any kind of emergency response, but this is specifically lakes that are asking for a certain amount of hours on their lakes, and their lake improvement boards approve the number of hours. So we have a rate for deputies with a boat, and then deputy without a boat, and then corresponding overtime rates. And then on your consent agenda, you will see 13 individual communities that have requested the contract with us, and those agreements are on the consent agenda today. The next item is the Woodward Dream Cruise special event signage for the road commission. This is our annual request, and it comes out of non-departmental contingency, and then it goes in the sheriff's office budget, and then we coordinate with the road commission. So the sheriff's office requests a traffic control order for the whole stretch of Woodward, and then the road commission is the only, they're the only ones authorized to actually place the signs, so we have to work in conjunction with them. The third item is use of forfeited funds, so similar to the animal control, we have a law enforcement enhancement fund. It's a restricted fund that we have to come to you to get the funds transferred from that fund into our budget to, we're requesting to purchase equipment and specialized training. So I have subject matter experts here to answer questions on those items.
I'm not the subject matter expert, by the way, in case you were wondering.
We will entertain any questions.
Well, let's start with 11A, the Marine Patrol Services Agreement. Are there questions regarding that item? Commissioner
I'm sure there's
Space?
a question, more of a comment. And I'm sure this is of no surprise to probably anybody here. But the increases are large. Tomorrow's increases on another topic will be larger, but that's a different topic we'll talk about tomorrow. Year one is roughly from a 10% to 14% increase between the 4 different levels. And then each year after that, it's about 8.3%. So overall, you have like a 30% increase over those 3 years, similar to the sheriff's contract. So there's no way I can support these rates, just as I couldn't support the sheriff's rates. You know, I love the Marine Patrol. I think we need more hours on these lakes, and I've always pushed for it. And I will support all the contracts because municipalities have had time to review those and approve those. So that's really up to them. But these rates, I personally can't justify them, just like I could the sheriff contract rates. So.
Thank you. Commissioner Erickson Gall?
Okay, so I guess I'm misunderstanding. Maybe I misread this. The rates, these are new rates. I thought it said that we had already approved the rates. These are separate from the rates that we approved.
Yes, these are separate. This is for marine patrols on local lakes.
Gotcha.
And it's just specific lakes that have asked for it. So it's based on their lake association that has asked for us to patrol, and then they work with the local community. So then our agreement is through the local community.
Okay.
Any other questions regarding this item? Would you prompt the vote on this item, please?
You have 4 yeas, 1 nay.
All right, motion carries. Our second item is regarding the signage for the Woodward Dream Cruise. Are there any questions regarding this item? Would you prompt the vote on that item?
Five yeas, 0 nays.
Thank you. And the last item is how we're using the forfeited funds. Any questions regarding this item? Like, would you prompt the vote on this item?
Five yeas and 0 nays.
All right, motion carries. So,
Spend wisely.
is there anything else you'd like to add?
Just the consent agenda. So do we okay?
All right. So those three items have passed, and we move to our consent item. Gay already mentioned there are 13 local agreements for Addison Township, Bloomfield Township, Commerce Township, Highland Township, Independence Township, Keiko Harbor, Novi, Orchard Lake Village, Orion Township, Sylvan Lake, Waterford, West Bloomfield, and White Lake. I have a motion by Commissioner Powell and support from Commissioner Taylor.
You should have said peas. I'm
That's
just
okay.
playing.
All right, anything you wanna add regarding the agreements with these cities for the
I got a
marine
question.
patrol services?
We just kept the same amount of hours, right? So I think that the hours were the same as they requested, and so it's 13 communities, but I think right now there's 19 lakes, so some of the communities have multiple lakes that they're the lakes are requesting patrol, so.
Commissioner Powell?
Have these communities been notified of this potential increase already?
Not yet, we have not communicated with them, so we're waiting for board approval
Oh,
on the
got it.
rates.
Okay, I was
We'll
just making sure the order. So now we need to let our commissioners know that we've done this, so just in case they're aware. So is there any way, staff can just let them know that these went out, just in case they need any information to discuss with their leadership of
Let me
their
check.
communities?
Staff?
Or eventually, could we send it out? I'm sorry, I didn't know,
Yes.
Okay, thank you.
Have to go before
Thank you.
finance first before.
What, I'm just saying, once we go through the motions, we do not want any commissioners on both sides to be blindsided, and I know that we moved on something like this. And cause possibly they may get calls from their local leadership. We've been through this rodeo once, and I don't want us to be blindsided about this again. Thank you.
Well, this is probably our third rodeo because the second is regarding the property assessment increases, so.
That's coming up.
But you're right, we need to advise and update our communities as soon as possible
And our
regarding rate increases, regarding any
Yeah.
rate increases.
Yeah, okay, I just was making sure we in that order, cause we was out of order at one point and got.
Commissioner Spitz.
Thank you, Madam Chair. Just for clarification, so these are just interlocal agreements, there's no contract amounts in them?
Yes, there's budget amendments in them, but basically we have it budget, I think they have it budgeted at what the current 25 rate is. And so the budget amendments that are in each item are just for the increase of what's budgeted already. If that makes sense.
All right, so with us approving these, they're gonna go to the municipalities for approval next
Yes,
with the new rates, so that, but they
Yes.
have not been made aware of these rates at all?
not yet
They
because.
should expect them
we-
based on the past, but
Yes,
some of these don't have contracts with the county though for
Right.
leasing, so they might be surprised.
possibly.
So is there any expectation that some of these communities were gonna change their contract hours based on the new increase?
Any
I would say what most likely will happen, if they couldn't afford it, they'll just reduce their hours by a few.
That's my figure.
Typically what happens is the associations give money to the townships, and if, let's say they collect $5,000 from Marine Patrol, I would assume what some of the communities will do is they're collecting that money already, they would just contract a little fewer hours with the sheriff's office.
Okay.
Possibly, or they may add to it.
That's what I figured.
And these are lower, they're not all 1,000-hour PTNEs, like typically some of the lakes will have 200 hours or something like that, cause it's only a
Just holidays.
certain number, hours on the weekend, and so we have really like low hour positions that are assigned to these. So it's not an issue for us to navigate that if they lower the amount of hours.
Any other questions? All right, would you prompt the vote, please?
They share the same size. But the economy is shifting.
If you, 5 yeas, 0 nays.
Stuff
Motion
gotta be
carries.
paid.
Thank you. We've arrived at our last public comment. Is there anyone from the public wishing to comment on any topic? Seeing none, public comment is closed. Our agenda is complete unless there's any other business to come before this committee. Seeing none, we are adjourned at 11:36. Thank you.